Okay, good morning, everyone. My name is Darshan Mehta. I'm the Medical and Education Director for the Osher Center for Integrative Health here at Harvard Medical School and Brigham Women's Hospital. And it's really my joy and pleasure to invite you to our March Grand Rounds. We're really excited to have both our speaker and topic for this month, and I'll just introduce him just momentarily. Um, so before that, let me just share my screen here. Okay, so today we are really excited to have Dr. Howie Sesso speak on nutritional supplements and well-being outcomes. Dr. Sesso is the Director of Nutrition and Supplements Research for the Osher Center for Integrative Health at Harvard Medical School and Brigham and Women's Hospital. He is Associate Epidemiologist and Associate Director of the Division of Preventive Medicine also at Brigham and Women's Hospital, an Associate Professor of Medicine at Harvard Medical School, and Associate Professor of Epidemiology at the Harvard T.H. Chan School of Public Health. As many, if you're new to our Grand Round series, you are able to obtain CME credit. For CME credit, please email us at hmsoshercenter@bwh.harvard.edu. And please include your full name, your degree, and your institution if applicable. We are in the Zoom webinar format, so please please remain on mute until prompted for Q&A. Also, please type your questions. If you see at the bottom of your Zoom screen, you'll see the Q&A box, and that'll be just click on that and just please type your questions into the Q&A box. As you can tell, the meeting is being recorded. We will be posting this onto the Osher Center website in the upcoming week after the recording is completed. And we'll let you know through our listserv. As a preview to next month's, we'll be back on our first Tuesday of the month series for the Grand Rounds. And this is going to be exciting because as April is honors Earth Day, we are featuring our planetary health Grand Rounds. And this will be an integrative approach to patient care in the face of climate change. This is going to be co-led by Dr. Winnie Armand, who's the Associate Director for the Mass General Center for Environment and Health, and Dr. Barbara Walker, who's an integrative health and performance psychologist at the University of Cincinnati College of Medicine and affiliated with the Osher Center for Integrative Health at the University of Cincinnati. So we're really excited, so please do join us on Tuesday, April 7th from 8 to 9. Okay, so with that, again, it's my joy and pleasure to introduce Dr. Howie Sesso, and again, on nutritional supplements and well-being outcomes, and I will turn it over to Dr. Sesso.
Thank you, Darshan. And it's a pleasure to be here. Pleasure to speak with all of you today as I'm getting my screen share set up here. One thing to note is that when we think about nutritional supplements, of course, it connects very strongly with nutrition as well. I'll be trying to focus a little bit more on supplements for today, but the two of them are obviously intertwined. And my presentation today is coming from kind of dual perspectives. One is my training as an epidemiologist, but also as a clinical trialist. And my interest in nutrition research has really evolved considerably over the 2+ decades that I've been doing this type of work, and I hope to share some of my insights with you today. So just some disclosures. One thing that is extremely important in the context of dietary supplement research is that it's almost impossible to do this research without some component of industry supporting that work. So I'd just like to acknowledge some of the disclosures here. Let me start with a very simple point. We know that diet is incredibly complicated. This was something that came out in the Scientific American, a nice visual summer of last year. I'm not asking you to be able to read all this at this hour in the morning, but at the same time to appreciate that when we think about nutrition and vitamins and minerals, it's different rich food sources as well as where it might be stored and how it's utilized in the body. It's incredibly complicated. And for these reasons, it really makes it challenging to do this type of research, whether it be nutrition or dietary supplement research. And it's not just diet. Dietary supplements are just as complicated. Most of dietary supplement research is guided around what's called the Dietary Supplement Health and Education Act, or DSHEA. This came out about 3 decades ago, and this is still used as our standard definition through the government of what a dietary supplement consists of. It's essentially and I put in quotes, a dietary ingredient intended to supplement the diet. And it's taken by mouth, and it include a whole litany of different types of compounds. It's vitamins and minerals, which we'll focus more of our time on, but it easily extends to herbs, botanicals, amino acids, enzymes, metabolites, organ tissues. And if you go to any vitamin store or CVS or Walgreens, you'll see very quickly just how much is out there. And this comes not just in the form of pills or tablets or capsules, but it extends to liquids and powders as well. So because of DSHEA, there's a regulatory framework by the U.S. Food and Drug Administration that considers supplements to be food and not drugs. And for that reason, the amount of data that need to be happening, that have to be generated to support something that is on a shelf that you might look to purchase or even online is a very different ask than what we might see for an antihypertensive or other medications that we have to be prescribed. There are specific labeling rules, and it also, when the DSHEA Act was put forth, it also established what is called the Office of Dietary Supplements that's at the National Institutes of Health. So dietary supplements are also big business. This is just, overall in the US in 2022 is a $61 billion industry. And this is just a classification on the left as to some of the products that are included. It's not just vitamins and herbs and botanicals, which do take up about half of the market, but it's lots of other specialty supplements and meals and other types of things too. What's interesting on the right is that this is specific to multivitamins, but it's true for most other supplements as well. You'll see a real big spike here that happened in 2020. And as you can imagine, it was because of the COVID-19 pandemic that emerged. A lot of people turned not just to multivitamins, but to other types of individual and other types of supplements, believing that they might have a role in preventing or mitigating the effects of infection, such as SARS-CoV-2. What's also interesting is that if you look, and this is a little bit more historical from the turn of the 21st century to the early 2010s, but these lines basically extend the way they are to today. Supplement use continues to stay the same in the US. People continue to use it. If anything, they swap out certain things that are a little bit more hip or popular now compared to what might have been a decade or two ago. The other thing to note are two messages. On the left panel, we see that as we get older, dietary supplement use, the prevalence increases. Perhaps not surprising, but even in those who are between 20 and 39 years of age, still fairly high, about 40%, and this persists. On the right panel, we see also that the prevalence of dietary supplement use tends to be higher in women than in men, not just overall, but if you look by age, you'll see it consistently higher in women compared to men as well. What's also interesting is that if you look not just at any supplement use, again, looking overall here in the left panel, but also in the darker blue is those that are taking multivitamins. Multivitamins, it should be noted, is the most common type of dietary supplement that's used in the United States and most parts of the world. And again, women tend to use it more than men, and there's a strong age gradient also. But as you can imagine, despite this being a 60, 70, $80 billion industry annually, the amount of data, as you'll see, that supports or even it starts to look at some of these supplements and for their potential benefits or risks, safety is actually quite modest. So there's a whole other aspect of dietary supplement use that we won't get into deep detail on in the next two slides, but just to introduce this idea, and there's an interesting psychology that goes behind taking dietary supplements. And this is something that's extremely important, not just in the context of the work that I do, but thinking of it more broadly in the context of integrative health. It's that when you start taking a dietary supplement, it seems like it's hard to stop. And this gets into some of the topics that have been brought forth from our Osher Center in the past regarding the placebo effect, for example. And there's a belief that once you start taking something, maybe it's working, maybe it's not, but if it's not hurting you in some capacity, you tend to keep on taking it. And so if you look on the left, what this gets at on the first bar here for overall, that the vast majority of supplements that people take, they've been taking for at least 10 years. And this even extends to people who are in their 20s and 30s. About 65% of those who are taking supplements have been taking them for at least 10 years. And as you can imagine, with age, that percentage increases. People tend to start taking supplements and then not stop. Why is that? And I think those are important questions that we can bring not just from a research perspective, but bringing it down to the clinical and individual patient level too. And kind of sticking with this theme, oops, excuse me. And one of the other questions that comes up all the time is why do people even take nutritional or dietary supplements in the first place? And here it gets a little bit more interesting. Again, the psychology of taking pills is quite fascinating to me on its own. Most people are usually going to take supplements to either maintain or improve overall health. You would think that supplements are inherently supposed to supplement the diet in some capacity, but as we can see on the left, only about 20% are actually supplementing their diet in some capacity. Now, is that because they've had a conversation with their healthcare provider to realize that there might be nutritional deficiencies in some way? We don't have that level of detail, but it raises important questions. Many other people will take it to prevent health problems, to get more energy. To prevent colds and boost the immune system, this actually had increased, depending on the timing of this survey, as you can imagine, this was a little bit higher at one point. It's come back down a little bit too. But what's interesting here and a little bit on the right panel is that very few people are taking dietary supplements because of a specific healthcare recommendation. So overall here on the left for total, we see that about 1/4 of US adults are taking supplements because of a specific recommendation. It's a little bit higher for women versus men overall. It's probably higher here in those who are in their 20s and 30s, perhaps because of the prenatal vitamins. We don't know for sure. But there's an important implementation gap that's in place with dietary supplements where those who are taking supplements aren't necessarily heeding or even perhaps even asking for advice from their healthcare provider or network about what they should be taking or not. They're clearly making these decisions based on other factors that we need to understand better. And whether these are viable sources of information is of greater concern from my perspective. I'd like to just make a brief comment on herbal supplements. My talk will not be covering this in enough depth, just given the breadth of this topic in general. But we also know that at least 20% of US adults are using herbal supplements in different forms. But again, only about 1/3 of users actually tell their physicians about the fact that they're using them. So again, we have this disconnect between what people are taking, what's in the proverbial brown bag, versus what their conversations might be having with different healthcare providers. And in the context of integrative health and medicine, I think this is an extremely important area that we need to develop further and understand how to get patients and providers talking more about this. And just a few examples. I mean, here at the bottom, I think as many of you are aware, there are many different types of herbal supplements. This is just a partial list. The evidence supporting these is, I would say, on average, not nearly as strong as it would be for most of the common vitamins and minerals and other types of dietary supplements. So there's another issue here that comes into kind of why people are taking dietary supplements, and has to do with the label claims that can come out through that DSHEA Act that I had indicated before that was from 1994. I like to call this the Jeopardy effect. I'm a fan of Jeopardy, but one thing I've noticed for a long time is that whenever I'm watching it on television, has almost always been an ad or two or three for one particular product called Prevagen, which has been touted to improve memory. One of the challenges of dietary supplements in terms of research, as well as for us as patients and as providers, is that this statement at the bottom, before I go through the different types of claims, is almost on should be on every single supplement, which is that this statement has not been evaluated about a health claim by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. I mean, if I were to read that as a consumer, you should be asking yourself, wait, why am I taking this in the first place? So again, there's this disconnect. Moreover, the types of claims that you can put onto any type of dietary supplement is actually the bar is quite low, I would say. You can add things about the nutrient content, a high or a low level, or a reduced or more of something. You can talk about structure and function claims in a very general capacity. As one example, antioxidants maintain cell integrity. Well, that's fantastic, but how does that translate to me taking a supplement and improving some aspect of health and wellness that I'm trying to target for some reason? There are qualified health claims that can be done, and this is developed for consumers to benefit from more information on some particular supplement and what they might be able to do with health outcomes. There's a petition process that goes to the Food and Drug Administration. This actually takes years usually to play out. Only a small proportion are approved. And one example that you have here is that lycopene-containing tomato-based foods doesn't say it will, may reduce the risk of cancer. The one good thing with these qualified health claims, even though the language isn't very strong, is that both the manufacturer and the FDA are jointly responsible for ensuring that this claim, the language is approved and valid. But the reality is that the current state of dietary supplement regulatory affairs in the US is, I think, fairly weak. DSHEA literally eliminates the need for definitive large-scale or even medium or smaller-scale clinical trials. And for many companies that are producing supplements, particularly those that are a little bit smaller in size, when they're given the choice between investing in advertising versus research, most all of them will be more likely to invest in advertising because that's a way to increase sales. When you do research, there's very little incentivization for these producers to invest in very well-conducted studies, not just clinical trials, when, again, you can do these label claims very easily. The higher hurdle health claims require much riskier, larger scale or medium-sized trials for outcomes that might not necessarily show up. So you might have a product that might be touted for something from the allowable claims, but when you test it, if you find that it doesn't work, well, you've just essentially put yourself or jeopardized your business. But in fact, well-conducted trials can, in fact, highlight the safety, the quality, and the potential efficacy and effectiveness of dietary supplements. This is where we have, in essence, an implementation gap that's been created by our current state of regulatory affairs in the United States. So how can we best examine the health effects of dietary supplements? You know, we go to the store, and I know every time I walk into a store, I'm kind of floored by the number and diversity of products and the advertising that goes along with it. Studies ideally should be focused on clinical trials, whether short or long term. Many of the studies that do get published are often what we call observational or cohort studies in different designs. But the problem with those is that we know that people who choose to take dietary supplements are likely different from those that do not. So clinical trials have a very unique role here. The problem is that as research comes out, as you see on the left, the media pays very little no attention to the design of the study. They just like to focus on their headlines. And so that puts the public as well in a need for more education and information, whether it be us through Osher or other means, to learn more about what dietary supplements can and cannot do and which ones they should consider taking. And just to give you an example of some trials that I've been doing that have looked at supplemental magnesium and blood pressure, when these trials are done, I mean, these are relatively smaller trials, and this is one that was looking at people who are middle-aged and older, have elevated blood pressure, but not necessarily taking blood pressure medications yet. And doing these small trials takes time, it takes energy. And in fact, when you get the result of these trials, and this is just a summary of this first trial of two, I'll show you the second in a moment, we see that taking a magnesium supplement among other things, has been touted for blood pressure lowering, and we see evidence for it. The magnitude of effect is fairly weak. It's about 3 millimeters of mercury after 12 weeks of supplementation. This is for 480 milligrams per day of magnesium. Um, but it's hard. You need bigger studies to be able to detect modest effects. But we also found, in addition to this main finding, stronger effects for those who had elevated systolic blood pressure of 130 or more, and also a stronger effect in women. So ideally, even these smaller trials, one's trial should beget another to help move the field forward. And in fact, we then initiated a follow-up trial that's just completing. Actually, I think our last follow-up visit is this week, looking again at the role of magnesium glycinate for blood pressure lowering, but we changed the population. So we elevated the inclusion criteria for people who have systolic blood pressure that aligned with the strongest effects from our previous trial. And we allowed people who are taking antihypertensive this time around to try and increase the generalizability of these findings, and also increased our sample size. We've doubled it approximately. And so by building these blocks of studies and trials, we can better hone in at whether specific supplements may or may not work. Now, what's interesting is that our research group here in the Division of Preventive Medicine and Osher Center also has a very rich and long history of doing not just smaller, but also very large-scale, long-term clinical trials testing different dietary supplements and health effects on clinical outcomes. And I'll just briefly touch upon a few examples of this before I branch off into some other topics around wellness and aging. But as one example, the vitamin D and omega-3 trial, or VITAL trial, looked at vitamin D and omega-3 for looking at cancer and cardiovascular disease endpoints, among others. And these trials are incredibly important to establish kind of the longer-term effects of dietary supplements on health. But as you can imagine, in these types of trials, these take not just months, they take many years to conduct. That's not a bad thing. The research is incredibly important. But at the same time, the amount of time that's required really requires this lag of time makes it difficult for research to more quickly feed into the public discourse about the benefits and risks of potential supplements. And in the case of vitamin D, there was some potential, the overall effect of cancer, its primary outcome was no effect at the top row here with a hazard ratio of 0.96. But as is often the case with these trials, when you start to dig deeper into other outcomes, you start to see some findings that emerge that require follow-up. For example, cancer death, it was not significant, but rather, excuse me, it was a 17% potential reduction that warrants additional work too. In addition to the vitamin D intervention, we also had the omega-3 fatty acid or fish oil intervention as well. Here again, there was no finding for the primary endpoint of major cardiovascular events. But again, you dig deeper and we see that for total MI or a heart attack, there was actually a significant 28% reduction. And there are other indications for other cardiovascular endpoints below where there are some strong findings for total CHD and death from MI as well. So these larger trials tend to get some top line findings, but the kind of the details matter too. I like to turn attention to multivitamin and multimineral formulations. These are the most used dietary supplement in the US again, but this is equally complicated. Again, there are tons of formulations to choose from, and there's different target populations. It could be for kids, for men, for women, for older adults, targeted outcomes. It could be for general health, but it could be for bone health, eye health, cardiovascular health. We'll talk about brain health in a little bit more detail. But developing recommendations and guidelines around something not just for multivitamins or multimineral formulations, but for other types of supplements is so difficult because there are so many products out there for which we don't know about consistency of the effect. Regarding multivitamins in particular, I've been involved in two long-term large-scale clinical trials. One is the Physicians Health Study 2 trial. This was a trial in about 14,500 middle-aged and older male physicians around the US. In this trial, again, it took about 11 years of follow-up for it. So you can imagine, again, it's kind of a delayed gratification, if you will. We found that a multivitamin reduced total cancer by 8%. And in fact, the effect was stronger among older men who were 70 and up. Sorry, I'm not sure why that happened again. So among men who are age 70 and older, there was an 18% reduction. And in fact, even in secondary prevention, the effect was stronger as well. Even these longer trials look at other endpoints, and in particular, the multivitamin was also reduced, associated with a reduced risk of cataract and cataract surgery. But again, even these longer trials, one big trial or one smaller trial, as you saw before, begets another larger trial. And so the results of the Physicians' Health Study 2, in part, helped to initiate what's called the COCO Supplement and Multivitamin Outcome Study, or COSMOS. This was another trial. It wasn't quite as long as PHS2. It was about 3.5 to 4 years, but it was in about 21.5 older men and women around the US who were free of CVD and recently diagnosed cancer. These trials are rich opportunities to not just look at cardiovascular disease, cancer, mortality as endpoints, but as we'll discuss, other aging outcomes. What's interesting is that we couldn't replicate the previous findings in terms of statistical significance in Cosmos for the effect of a multivitamin on cancer, but we still got pretty close. The hazard ratio was overall no effect, but if you look among men in Cosmos, the hazard ratio of a 6% reduction was actually very close to the 8% reduction we saw in the previous trial in PHS2. But in fact, we also saw that for invasive lung cancer, there was a significant 38% reduction in risk for those taking the multivitamin too. So again, when we have these big trials, we like to focus on a top-line finding, but all these other findings matter too. And even for invasive lung cancer, we had this 38% reduction in Cosmos. In PHS2, we actually had seen a 16% reduction. So we think there could be some informative information there. And even for total mortality, as I'll show you later, oops, not sure why that's happening. For total mortality, this 0.93 or 7% reduction in Cosmos was actually identical to what we saw in the Physicians' Health Study 2 as well. So when we think about approaching future research in dietary supplements, hey, it's great to do these large-scale trials that I've been involved in, but not every trial must be large and long to be informative. And in fact, we have to think about minimum requirements for any dietary supplement. We have to think carefully about objective assessments of compliance and response. Are there biomarkers that can reflect that, or other markers? Quality and safety matters. Do differences in the formulations matter? Every so often you'll hear in the news that there's some compound or some supplement that's been adulterated or has high levels of things that it's not supposed to have, or it's not marked as having what it's supposed to. We need better abilities to convey this information to the public about quality and safety. But more importantly, we need to focus better on the life course and not just, hey, CVD, cancer, death matter, but we know that people are taking supplements throughout their life. And so we need to better address that. And thinking about endpoints such as cognition and mental acuity, wellness, sleep, mood, and stress, falls, infectious disease, cardiometabolic outcomes. This is really the future of dietary supplement research and education for that matter. So I'd like to introduce a question, which is, what is healthy aging? I would say that healthy aging, or optimal health, you'll see a lot of other ways that it's expressed. To me, it's much more marketing than targeting specific health outcomes. So from a labeling and marketing standpoint, I think it's much more problematic, and it's actually confused a lot of consumers. And honestly, even in the scientific community, we're still trying to grasp what constitutes healthy aging. There is no standard definition, whether objective or subjective. Is it the lack of disease? Feeling your best? We can all think of it differently. And this is where, for me, integrative health can actually have a profound impact in the field in thinking about what is wellness and healthy aging. So there is no standard term. And there is no single approach to measure in some way healthy aging. Is it a clinical assessment? Is it through surveys? Is it through a blood workup or other testing? Is it an assessment of nutritional status? I would say that the field as a whole is still trying to figure this out. And healthy aging, again, is something that happens, of course, across the life course. It's not just living longer, it's living better. So whether it's focused on chronic disease or brain health or other aspects of wellness or quality of life that you see listed here, this is something that we need to think carefully about throughout the life course, and integrating nutrition and dietary supplements with the other modalities that we care so much about. It's exercise, it's wellness, it's Tai Chi, it's doing all these other modalities in combination that can improve health. And I want to take a step back and think a little bit more about what geroscience or healthy aging constitutes. Again, there are lots of different perspectives on this. In a way, you can bring it to a biological level, right? So it's the study of molecular and cellular mechanisms that drive the common chronic diseases and conditions as we age. And again, is it focused on extending life? Is it about maximizing wellness and quality of life? I mean, ideally, it should be both. Most of the research, though, has been focused on middle-aged and older adults. We need to think about that group still, of course, because that's where a lot of the chronic conditions happen, but wellness is a lifelong task. We can always work to improve it. And we don't know whether changes in these geroscience markers, however we define them, really translate to meaningful improvements in what we'll call healthy aging. And this is a very active area of research for myself. I want to introduce a concept here called intrinsic capacity. This was adopted by the World Health Organization in 2015, and it's kind of a concept. It's not a specific measure. It's a score that's generated by assessing a wide range of physical, mental, and other aspects of ourselves. It's supposed to reflect healthy aging, but we still don't know how to measure it. And what can we intervene on to improve it over the life course? And as I'll discuss, we'll talk a little bit about some of these areas at the top. This connects very nicely with a lot of the work that we do in the Osher, as well as you'll see in the next few slides, talk about epigenetics and microbiome very briefly. There's a lot of research and monies that are interested in this area too. These are just two recent, actually the one on the bottom was on pause. The belief is this is going to come back up through the Department of Health and Human Services, but there's a lot of interest about these questions. How can we extend lifespan and prevent the onset of age-related diseases? This also connects really nicely with the concept of whole person health. This is something that the NCCIH has been espousing for several years now. There's a grant mechanism to establish a research and coordination center. When we think about whole person health, obviously there are many things that go into it. We are at our core humans that have to eat and expend energy. And so we know that diet and nutrition has a role across all of these pieces as well. And understanding this better to me is of extremely high importance. And in fact, when we think about mechanisms, we know that dietary supplements and nutrition may impact, for example, the microbiome and improve healthy aging. The microbiome has many different aspects to it. And when we think about it, ideally at the top here, we would have some sort of a dietary intervention that can intervene and improve the microbiome and in turn improve healthy aging. What we've seen in Cosmos already, and this is through some pilot work that we've done, not just for the cocoa extract intervention, but also for our multivitamin intervention, they do change the microbiome. What we need to better understand is if these dietary supplements are changing the microbiome, how do those changes in the microbiome translate to improvements in health in different capacities? That is an area of active research that we still need to learn a lot more about. Epigenetics is another area that's of great interest in the context of wellness and healthy aging. And there's mounting evidence that demonstrates that biological aging, and not just chronological aging, can accurately reflect what we call intrinsic capacity or some marker of aging. The idea with epigenetics is that we all have these multitudes of DNA methylation sites throughout our genome. And as we age, these genes get switched off. So as methylation decreases, we get older. And I might be 50 years old chronologically based on my birthday, but the idea of epigenetics is that you can generate these clocks that estimate biological age. So I might be 50 years old, but based on a number of factors, whether genetic or lifestyle, my biological age measured through epigenetics might be 55 or it might be 45. And so based on that biological age, we can identify those who could benefit more from particular interventions. And as an example in Cosmos, what we've seen, there we go, is that if we look at the multivitamin intervention in Cosmos, we see that over 2 years, those that are randomized to take a multivitamin versus placebo, these negative differences denote improvements in biological age over a 2-year period annually. So we see here that a multivitamin taken daily might improve biological aging. There's also the concept of cognitive aging. Obviously, our mind is something that we think about all the time, but more to the point, we know that over the course of life, and not just here we see in our 40s, but really even earlier, right? We're constantly using our brain, and that brain is changing over time. Our ability to remember things and to do multitasking and other types of aspects of cognition are changing. Of course, there's normal age-related cognitive decline, or arrow in green, but we want to think about how we can prevent these slopes from going down toward mild cognitive impairment or even dementia, not just in your 70s or 80s, but earlier in life. So preserving cognitive function throughout the lifespan, to me, is one of the key cornerstones of successful aging. And in fact, we've done a lot of work in this area, particularly through our Cosmos trial. I'll present to you briefly 3 different ancillary studies that looked at aspects of cognition related to our multivitamin intervention. This first one was what we called Cosmos Mind. This was a telephone-based assessment of cognition that was done in more than 2,000 Cosmos participants. And what we found was that daily multivitamin supplementation appeared to slow cognitive aging by about 60%, or about 1.8 years. When you look at this graph, though, it looks a little deceptive, because if you see those that were in the active group or taking the multivitamin, oops, not sure why that happened, in blue, the placebo group also improved over time. One of the challenges in cognition research is that there's a learning effect or a training effect. If you've done a test once and you're going to do it again, you kind of remember, right, what those questions were. So you're a little bit better prepared for it in some capacity. Even so, even with the training effect accounting for that, we can see that daily multivitamin use slowed cognitive aging. But more importantly, what we found in Cosmos was a consistency of effect across different types of cognitive assessments. A separate ancillary study that we did was something called Cosmos Web. This was where we had our participants basically go online and do a number of different assessments, different tests that were examining the hippocampus and other aspects of multitasking and cognition. And this was done in more than 3,500 Cosmos participants, where they completed this at baseline, 1, 2, and 3 years follow-up. And once again, what we found is a similar learning effect, right? So both groups are improving, but more to the point that those in blue, the multivitamin group, had a greater benefit from daily multivitamin use versus placebo, not just at year 1, where our primary endpoint was, but the effect persisted over time across all 3 years. Reproducibility is the greatest strength of research, and what we have found in Cosmos is that we also focused on what we called Cosmos Clinic. So one of the nice things about our Cosmos trial is that even though it's a very large trial and was done remotely, we also had an in-person component, kind of a hybrid design to the trial, where we had in-person gold standard assessments of cognition. And what we found here was that for our primary outcome, a global cognition composite, and this was done in approximately 560 or so participants, actually about 500 at both time points, excuse me. But we found again that for the global composite outcome of cognition measured through many different types of tests, as well as focusing specifically on episodic memory, that once again, taking adult daily multivitamin in older adults improved cognition. And moreover, to kind of bring this all to a head, what we did was we then combined these studies that I just showed you into what we call a meta-analysis within Cosmos. And these were for participants that were not necessarily doing 2 or more of these studies, but for doing only one of them. But again, to the point, what we found was that those taking a multivitamin improved global cognition as well as episodic memory. Now, how much does this translate to an effect that you might sense? Are you remembering more? That's always a little bit more subjective. So there's always a subjective assessment to these improvements in memory and cognition. But what's always interesting with dietary supplements is that headlines tend to come up. So when this particular finding came out last year, there was a fair amount of play in the headlines about evidence suggesting that a multivitamin might help slow memory loss. And that's great. But a lot of times these don't necessarily translate to guidelines as quickly. And as you know, with headlines these days, something might reach the headlines today, but the news cycle is brief and people tend to forget. And we need more centralized sources of information to be able to convey not just the findings that might be beneficial for supplements, but also the findings that might be more equivocal or even harmful. We need to get that information out there to the providers and the consumers alike. So I wanted to come back to this graph from before. Again, thinking about healthy aging across the life course. One area that we're starting to expand upon in Cosmos in particular, not just for the multivitamin intervention, but also for our cocoa extract intervention, is thinking about focusing more not just on brain health and memory and executive function, but thinking more about depression and anxiety and sleep, pain, wellness, stress, physical function, falls and frailty. Our group here at Osher have been actively pursuing these topics more recently. We're going to be able to contribute much more diversely, if you will, to the types of outcomes that we think about. Now, of course, in Cosmos, we're focused more on older adults, so there are still limitations, but at least we can expand to these other outcomes. But we are also simultaneously in the middle of planning, hopefully what will be a new large-scale multivitamin trial that will be testing that will be tested in middle-aged adults. So those that are in their 40s and 50s, perhaps even in their 30s, not as much on these chronic disease endpoints, although I guess we could still look at those, but much more focused on wellness and healthy aging, understanding that these are the things that people care about over the course of different phases of adulthood and life. The other challenge that we face is that dietary supplement recommendations, again, are fairly weak. There's not much out there. As one case in point, not that I would expect the dietary guidelines for Americans to include them, because they're focused on food. And the last few iterations of the dietary guidelines for Americans, and including the updates that are forthcoming for the 2025 to 2030 iteration, the conclusions have been incredibly consistent that when we think about nutritional needs, they should be met primarily from foods and beverages, and especially nutrient-dense foods and beverages. I mean, I completely agree with that. But the question remains, and there still is this gap of knowledge about, well, that's great, and we should still make that our first line defense or offense in terms of trying to get people to change behavior, as well as movement and exercise and other aspects of wellness that Osher and integrative health does. But we can't ignore it. It's a big business. Lots of people are doing and taking these supplements without really knowing what they're actually doing. So it's not just the dietary guidelines for Americans, but it's also the Academy of Nutrition and Dietetics, or A&D. They argue that the routine and indiscriminate use of micronutrient supplements for preventing chronic disease is not recommended, given the lack of evidence. Okay. If you go back to the second bullet here, I mean, they certainly acknowledge that there are some cases in which there could be reasons to justify supplement use, but for the most part, it's hyper-specialized and almost too specific. For multivitamins specifically, as well as a few other supplements, there was one set of guidelines that came out in 2014, and they basically said that, the evidence is insufficient for multivitamins in particular. We've done big trials, but just not enough evidence there. And even with the Physicians Health Study 2 and Cosmos trials, when they updated the recommendations in 2022, they still said the evidence was insufficient. I'm not sure how much more we need to do to get from insufficient to sufficient or adequate. But even though they said that, if you look at some of the details of the recommendations for any cancer here for a multivitamin, we see that they show a significant 7% reduction in mortality, or any cancer, excuse me. Well, if I knew I can take something that can reduce cancer by 7%, I would consider it, perhaps. What we really need are more specific, either food-based or supplement-based guidelines. Now, flavin-3-ols are a little bit more of a food. This is a little bit this connects a little bit more with our cocoa extract intervention, but we need to get to be more, I think, thoughtful about our approach toward guidelines and being a little bit more specific toward individual, more commonly used dietary or nutritional supplements, or even herbals. Those are really not out there. And I think that the integrative health community can do, I think, a very important job to bring these types of topics more into the forefront and into our collective consciousness. And moreover, I think it's important to think about baseline nutritional status particularly in the context of what we call precision nutrition. And this can also apply to precision integrative health, right? I mean, not just dietary supplements, but other modalities. We know that we want to see if they work through research, but at the same time, we also know that not everything works in everyone that takes them. We know there are differences in nutritional needs and absorption based on sex, age, and many other characteristics. And again, most of the dietary supplement trials have really focused very little data and emphasis on how baseline nutritional status or other factors might modify the overall finding. We like to focus on the top level finding, but not the details and the subtleties of the mechanisms, the biology that underscores what might be happening or what might not be happening for a particular dietary supplement or nutritional factor. And traditional trialists tend to be reductionist and reflect the FDA drug trial mentality. What I mean by reductionist is that if you don't see an overall effect, and we saw this with, for example, the VITAL trial, just because there's no overall effect for what was pre-specified, it doesn't mean that these other outcomes and subgroup analyses don't matter. We need to think carefully not just about that, but other types of analyses, not just intention to treat, but per protocol or compliance-based analyses to better get at the subtleties of the effects. And so the future of dietary supplement trials have to counter this more reductionist approach. But hey, as I said before, diet is complicated. So how do we even assess baseline nutritional status? Where do you choose, right? We've got dietary patterns, supplements, foods, individual nutrients, and supplements you might be taking. Even to define baseline nutritional status could be challenging. In fact, the NIH nutrition research does have a strategic plan for precision nutrition. This was initiated back at the start of the decade and it's still going on. And it's about focusing on accurate and reliable dietary assessments and identifying objective nutritional biomarkers and using what we call multi-omics, such as the gut microbiome and DNA methylation and epigenetics, as I alluded to before. They're also partnering with what's called the All of Us research program, which is an NIH-funded research study. But this is an opportunity for research as well as for education. We know that dietary supplements could be more easily positioned for precision nutrition versus a food-based intervention because we can test them in easier to conduct placebo-controlled trials. And just as two examples in the Cosmos study, for our cocoa extract or cocoa flavanol intervention, there is in fact a novel biomarker of intake called gamma valerolactone metabolites. And this allows you to have a very objective assessment for whether someone is taking a dietary supplement or not. In this case, if they were randomized to the cocoa extract intervention in red, they had an increase in gamma valerolactone metabolite levels versus those in placebo. So we need more biomarkers that indicate what works and what doesn't. Even for a multivitamin, if you're taking a multivitamin or other types of vitamin and mineral supplements, we can measure. We already know how to measure 25-hydroxy-D, vitamin B12, folate, and others. We have other changes in serum carotenoids and vitamin E that's just been recently submitted for publication. We see that they increase with supplement use. So understanding how these changes in objective biomarkers translate to other mechanisms of effect for dietary supplements in combination with clinical trials puts us in the best position to move research and education and policy forward. So, moving forward, how do we think of this? Well, we know that people of all ages take nutritional supplements with, I would say, insufficient supporting data. But so if you've got a patient in front of you, why do people start to take these supplements? Is it because of their provider? Well, not that much based on what we saw in the data. So why are people starting to take them? Why do they continue to take them, not just for a few months or years, but for decades? Can we systematically improve the quality and demonstrate the safety of supplements? And of course, can these supplements improve not just the clinical outcomes, but the healthy aging outcomes? So, hey, we need more trials, not just large, but smaller, thoughtfully designed trials to test nutritional supplements across the entire lifespan. And this would hopefully translate to broader-based guidelines. And in fact, supplements are optimally positioned, again, not just for precision nutrition, but for precision integrative health. How do we fit these within the framework of whole person health? Can these really improve meaningful, healthy aging and well-being that people can sense and see through whether it's objective biomarkers or these more novel measurements such as intrinsic capacity. But ultimately, to do these types of studies and trials and even educating the public about dietary supplements as well as health providers, it's collaboration that matters. It's not just the studies here in blue. It's working with NIH, it's professional organizations and consumer groups, it's industry partners, it's all of us in academia and the hospitals and other entities too. So with that in mind, thank you for your attention, and I look forward to any questions that you might have.
Thank you, Howie. Wow, just a wonderful, I think, just taking us through this whole journey of how we think about dietary supplements and health and healthy aging at the same time. So, one question I think you already sort of addressed in thinking about specific ways of measurement. I guess as a corollary to that question of measurement, um, do you envision or have you started to envision testing like what who defines optimal health and aging through some of the work you've done and looking at some of these, some of the dietaries like, oh, this is what an optimally healthy person might look like, and we might want to look at this biomarker to define that. Have we how far away or are we on that trajectory?
We should be closer than we are. It's a great question. I think right now it probably looks more like a Jackson Pollock painting than it does something that's a little bit better organized. I mean, there are many different groups that are very focused on this question, not just in the context of, say, integrative health and medicine, but also the National Institute of Aging, and different funding mechanisms are looking at it from different angles. So this is actually a problem for the field. Everyone's got the right intention, but I think we need to better align efforts to try and come up with a uniform definition that at least most of us can agree to.
Okay. Okay. And then I guess another question that, and I think you touched on it a little bit, but maybe if you can go into it a little bit deeper, is thinking of the role that now technology and some of the AI tools that in defining, because oftentimes we were looking at a one-to-one target. You have one supplement, and you look at one target. And now all of a sudden we're looking really at obviously as a systems level, there are all these interactions, both positive and negative. And I'm just curious as to how research studies, especially the large data sets that you have managed over the decades, like how have they evolved to sort of think about that more critically?
Yeah, I think AI offers a lot of promise for how we can look at these types of questions that are inherently complicated, whether it be dietary supplements or nutrition or other modalities. Um, what we need to do is better educate ourselves with how to look at this much more holistically, right? It's a kind of an overused word, but it's an important concept, which is that, to look at a single supplement in isolation is a little too simplistic when we know that many people who are taking one supplement might be taking many others. So understanding those interactions, it's a concept actually that's called polypharmacy. Um, and this is something that we're actually very interested in trying to understand, not just how supplements work with each other or not, but also how they work with other medications and other health modalities and hopefully to improve health. But we don't know if that's necessarily the case every time. So there's definitely promise through our large data sets that we have and other ones that are out there in the public domain.
And I'm going to ask a question that I think is on many people's minds. You can sort of defer it if you'd like, but nonetheless, I'll just do my due diligence asking, thinking about the current sort of state of affairs in terms of research in this. Do we see um, areas of promise in terms of just from a policy and regulatory framework? Is this a promising time to be in this field? Is this sort of a little bit like we're going to have to sort of wait and watch a little bit? How do you feel about that as a researcher as well?
Yeah, I think actually from a research and even policy side, it's actually to me a very promising time to be in, despite, for just as two cases in point, obviously with a lot of the political changes happening right now, could the FDA be changing their approach toward DSHEA? Possibly. I'm not aware of anything specific, but that could be happening with all the other changes happening within Health and Human Services. But yet at the same time, even with, and this is one of the Q&As is in there, even with RFK Jr. now heading up Health and Human Services, I mean, their very strong stance revolves around good health, good nutrition. Perhaps dietary supplements have a role in there, but it would be nice to have more objective data and science to underscore that. So, like anything else, there's always opportunity. The key is to, and I think there might actually be more of a pivot toward appreciating health and wellness from a lifestyle standpoint, including nutrition and supplement research in the years to come, which would be great. We want to start there and not necessarily turn toward the other modalities that people often turn to.
I know as a, my esteemed predecessor at the Osher Clinic, as well as my one of the more common questions we face from patients has been on what should I be taking for X, Y, and Z condition, or what should I be taking to optimize X, Y, and Z? Are you aware of, or are you excited about any sort of tools that are on the horizon based on, obviously you've massed in a tremendous amount of data, the whole group in the Division of Preventive Medicine has massed all this week, but how is it shaped in a sort of in a way that clinicians are able to sort of synthesize that data? And are there tools out there that you feel excited about to help
Yeah,
us?
resources are lacking. I'll leave it just like that. It's not as if you can kind of go down like a choose your own adventure and answer questions or a Mad Lib, and depending on your answers, and actually there are many supplement websites that are out there that I would say perhaps even dangerously go through a series of questions and say, based on your lifestyle or goals, here's what you should be taking. It's rarely based on good hard science or practical aspects of it.
Mhm.
So what we really need to do is to build these types of tools and resources, not just for the public, but also for the health population as for the health providers too. NIH, for example, the Office of Dietary Supplements does have a very nice website that is a good resource for kind of here's a summary for each vitamin, mineral, other types of supplements, but it's a little bit more driven toward the health provider than the consumer. Beyond that, there's very little out there, and there's really an opportunity for us at Osher to take a very important step forward in this regard.
Okay. And then in terms of how, some of these, a lot of times it's data starts in sort of animal studies and then sort of there are sort of implications made to human. And if you were to think about if you had unlimited sort of resources, but we have the only thing that's a constraint is time, what do you see as the optimal way of sort of designing, future work? Like if you had sort of the financial resources to do it?
Yeah, no, I think there are many other ways for us to do clinical studies and clinical trials in particular. I mean, I think the traditional approach has always been kind of a one-off, right? We test one supplement for a small number of outcomes in a smaller population. Crowdsourcing and other ways of kind of gathering interest and support for studies is a very different modality these days than it was 10, 20, 30 years ago. And you can actually be much more innovative in clinical trial design to be able to test multiple types of supplements for different outcomes in a way that's actually quite thoughtful and scientifically sound. And this is also another way that we can future the research design process to better inform research in this area too. So yeah, no, I think these are opportunities.
Right. Well, again, on behalf of our team and as part of our leadership team, we're really grateful for the work that you have led and continue to lead and really we're excited about the future of this work. This is such an important topic, and so many questions are sort of out there on the horizon, and I think we'll definitely have updates in the ensuing months and years to come. So thank you again for an amazing, really well-rounded presentation, like really setting the stage for what is about to sort of what has already exploded, but even like we're only seeing the beginning of this explosion in the field of herbal and dietary supplement research, and as we think about healthy aging. So with that, let me just share just a few last slides. Just as again, thank you to all of the attendees here for attending. Just as a reminder, we have our next month on Tuesday, April 7th, the integrative approach to patient care in the face of climate change. This will be led by Dr. Winnie Armand here at MGH and the Center for Environmental Health, and also primary care provider and assistant professor at Harvard Medical School, and Dr. Barbara Walker, an integrative health and performance psychologist from the University of Cincinnati College of Medicine and the Osher Center for Integrative Health there. And then again, all of this work would not be possible without support of our benefactors. Please, if you feel inclined, consider making a donation. We have these monthly grand rounds, biennial network forum, the Tai Chi conference, our clinical courses at the Osher Clinical Center, and our mind body movement research and planetary health programming as well. So again, thank you to all of you, and thank you, Howie, for an amazing presentation. And we look forward to seeing you next month. So take care, everyone, and be well.